Well, a very good evening to one and all present out here, and those of you sitting and watching us in your respective homes. It's a pleasure once again on behalf of the Kidney Warrior Foundation to present one of the most awaited topics with the community. Well, a very good evening. Today we are here with two special doctors to talk about the topic Nephrotic Syndrome. To take great pleasure to welcome our doctors, Dr. Arpana Iyengar, Professor, former Head of Department of Pediatric Nephrology, St. John's Medical College Hospital, Bangalore, with more than 20 years of experience in pediatric nephrology. We also have with us Dr. Priya, Associate Professor, Department of Pediatric Nephrology, St. John's Medical College Hospital, Bangalore, trained in the USA, with 15 years of experience in pediatric nephrology. Welcome, doctors, on behalf of the Kidney Warrior Foundation. It's such a pleasure to have you both with us, especially for a topic like nephrotic syndrome, which has been the most spoken about topic within the kids of our community. And on behalf of the parents, I'd like to extend another warm welcome to both the doctors out here. May I request our doctors to kindly take over.
Thank you. I'm going to start sharing my screen. So are my slides visible?
Yes, go ahead.
Okay, so good evening, everyone. And first of all, I'd like to say a big thank you to the organizers from the Kidney Warriors Foundation, Vasundhara Madam and Mariam, for giving us an opportunity to speak with you all about a problem that we as kidney doctors, children's kidney doctors, pediatric nephrologists see quite commonly. Although it is certainly not as common a kidney problem or a common problem for pediatricians to see. So Dr. Arpana and I are really excited to get a chance to speak with you about the nephrotic syndrome. We'll start our session today by just briefly going through a little bit about the basics of nephrotic syndrome in the form of a story and in questions and answers. We'll go over the basics first. I'll do that with slides. And then Dr. Arpana and I will take a little deep dive to discuss a little bit more complex issues that I'm sure you all have been wondering about. And then, of course, we will be around to answer all your questions. So without further ado, here we go. Nephrotic syndrome in children, you ask and we answer. So this is, I'll begin with a story of Sonia. Sonia's get the slides moving. Sonia is a 2-year-old girl living in Bangalore. That's where we are. So we chose that location, but she could really be anywhere. And she lives with her parents and a sibling. And she's had cough and cold and a slight swelling around the eyes that her parents have noticed. However, though the cough and cold got better, the swelling gradually worsened every day and her parents got really alarmed. And then the swelling went on to involve her legs, her stomach, and her whole body looked quite puffy. So this made them take her to the doctor. Where they reached there, they said that apart from looking swollen, she also had less urine, and the urine seemed to look very strong or dark yellow. And the doctor said, I think Sonia has nephrotic syndrome. Girl is representative of who Sonia could be. And you can see, even though I've blacked out the pupils of her eyes, the puffiness of her eyes that is so typical of nephrotic syndrome. So the first question we'll address is what Sonia's parents asked. Doctor, what is nephrotic syndrome? And nephrotic syndrome in children is quite a common kidney disease that we see. To understand the basics, let's look at the picture down below of this cup of tea with a tea strainer with some tea leaves in it. So basically, the kidney has thousands of filters, and we'll look at that in just a minute. And if you think of the kidney filters as the tea strainer, the filters allow water and waste to pass through. That's the tea in the cup there. However, the job of the filters is not to allow proteins to pass through, and the proteins are present in one's blood. And if you look at the analogy here, these would be the tea leaves. We don't want the strainer letting the tea leaves go through. However, in nephrotic syndrome, the tea strainer, the holes become big and the filter becomes leaky. And so the tea leaves escape into the tea, or in kidney terms, protein from the blood escapes into the urine and gets wasted. So that basically is nephrotic syndrome. Now let's look at a picture of an actual kidney. So as you all know, we have two kidneys that produce urine, and the urine comes down to the bladder. Each kidney, however, is made up of thousands of filters, and the filters kind of look like a tea filter actually. The red tube there is the blood vessels entering the filter, and the cup-like brown object is the actual filtering membrane. And so that is what the filter looks like, and it is filtering the blood as it passes through the filter. And as you can see in the green dots there, those are the useful protein or the albumin. And the job of the filter is, although the blood enters the filter, protein should not pass through into the urine, and the urine should be clear, yellow, and free of protein. Now, in nephrotic syndrome, the filters, the pores of the filter become leaky. And so when the blood is filtered through, the protein molecules actually pass through the filter and into the protein. So as you can imagine, if there's so much of wastage of protein called albumin into the urine, it becomes low in the blood. And this leads to swelling of the whole body. Sometimes we see the protein in the urine as frothy urine or bubbly urine, if you've ever noticed it. So the question is, okay, there's protein leak in the urine, but doctor, why does Sonia have swelling? And this actually takes a little bit of discussion and a little bit of understanding. So when the protein escapes into the urine actually looks frothy. And when there is low protein in the blood due to it being wasted, the water from the blood vessels of the child actually escapes into the skin. So the child actually becomes a little bit dehydrated on the inside because the water escapes into the skin and the skin looks all swollen and puffy. Now, swelling is very alarming to see. However, it is, and it changes location with the time of the day and the position of the child. So you would have noticed that in the morning, the swelling is worse around the eyes and in the face. And in the evening, when the child's been running around, the swelling in the legs actually looks like it's worse. However, the amount of swelling doesn't change that much from morning to evening. It's just the location that changes. When the swelling is severe, it could actually appear in other areas like the abdomen and even the genital area when it is very severe. So Sonia's parents asked, why did my child get nephrotic syndrome? Everybody gets coughs and colds, right? Well, that's a very good question. We are not sure exactly why a child gets nephrotic syndrome, but we do know it's because of a triggering of the immune system in a susceptible child. Common viral infections like a cough and cold may trigger it, though they are not directly infecting the kidney. And you see here a diagram on the right where you have an immune cell releasing these orange triggering factors that seem to make the leaky. And when there is leakage, the green protein albumins pass through. So how does one confirm the diagnosis of a nephrotic syndrome? Really very simple. It's a urine test and some blood tests. So if you look at the table, the urine sample, we check for an albumin, which is the specific type of protein that's lost in the urine. Normally, there should be no or very trace amounts of protein in the urine. But in nephrotic syndrome, there's quite a lot. And if we look at the bottle and the on the right, then you will see that the way this bottle assesses the dipstick assesses the urine in a very numeric way, 1+, 2+, 3+, or 4+. And so in nephrotic syndrome, there is a lot of protein in the urine, usually 3+ or 4+. That's the simplest way of measuring the protein in the urine. There are other ways to do it in the lab as well, but generally urine albumin will be 3+ or 4+. Because it's being wasted in the urine, the blood albumin level will be low. It will be usually less than 2.5. Children with nephrotic syndrome usually have normal kidney function in terms of clearing poisons and toxins from the body. This is the serum creatinine value. And because of a sort of a complicated reaction, the blood cholesterol level actually becomes high in children with nephrotic syndrome while they are spilling protein in the urine. So it's this combination of albumin or protein in the urine, low albumin in the blood, high cholesterol that defines simple childhood nephrotic syndrome as long as there's a normal kidney function. So how does one treat nephrotic syndrome? I'm sure these medicines look very familiar to you, right? Visalone, prednisolone syrup. Steroids are indeed the cornerstone of therapy. They are very important. How do they work? They suppress the immune system that has been triggered. When this treatment is effective, the kidney filters return to normal. Important to remember that 90% of children with nephrotic syndrome will respond to steroid therapy and the urine returns to normal. We usually do a TB skin test before starting steroid therapy, just to be sure the child does not have a hidden tuberculosis inside. That could get worse if we suppress the immune system. The route of steroid therapy is oral, either as tablet form or as liquid form. First course of therapy is given daily for 6 weeks and then alternate day for 6 weeks. So Sonia's parents asked, Doctor, I'm very frightened about steroid side effects. I've looked on Google and there are all these scary things about growth effect, high blood pressure, high blood sugar. What should I be worried about? Well, we're here to tell you that yes, steroid side effects when we treat nephrotic syndrome are common, but they are not the scary long-term ones. They are the temporary side effects. Change in appetite, the child is always hungry. Change in behavior, you may see some temper tantrums in the child because they're usually quite young children. And change in the appearance of the child. They look like they have swelling, actually they don't. It's because of a redistribution of fat in the body. Their cheeks look rounded, their stomach looks prominent. Some of them may even develop a little extra facial hair. But it's important to remember that a short course of steroids usually leads to only short-term minor side effects. What should my child eat, they ask? Well, the first thing we want to stress is that actually not about eating, but of drinking. The child should drink plenty of fluids. Remember what I said, that they were actually a little bit dehydrated on the inside. So we never tell children to drink less fluids. We never tell them to restrict fluids because some people believe that that may reduce the swelling. That's actually not true. And we don't want to worsen their dehydration. So plenty of fluids in any form. Healthy, home-cooked food, your normal diet that you give your child is excellent. Eggs are okay, eating non-veg is okay, fruits and vegetables are okay, and adding the small amount of controlled amount of salt that you do when you cook at home is perfectly fine because no child wants to eat completely tasteless food. It's important to remember also to drink adequate milk because of the calcium that it provides to keep the bone strong during steroid therapy. So what should I avoid? That's every person's concern. Is there food that should not be eaten? And as you can see from the pictures here, I'm sure you'll be able to guess some of these. The restrictions are actually not many. During the time of swelling, when there is protein leak in the urine, it's important that the child does not eat extra salt, not because it causes kidney damage, but it just makes the swelling look worse. During steroid therapy, children are always hungry, so it's best to limit deep fried oily food so that they don't gain too much weight. And remember, most importantly, that changing the diet does not change the course of nephrotic syndrome. It's just to maintain a good state of health and to limit swelling. Let's talk a little bit about what danger signs Sonia's parents should watch for when they start steroid therapy and are giving her medicine at home. The first thing to talk about, as you can see in the pictures on the right, is a worsening of the swelling. This is a child whose abdomen has accumulated a lot of fluid. We medically call this ascites, and this becomes uncomfortable for the child if it is very large in amount, so that they may refuse to eat and drink. And of course, as you can imagine, if children don't eat and drink, they may become very tired, they may be inactive, and this is a child who may need admission for medical management, additional management for reducing the swelling. Swelling in the genital area, as you can see in this picture of another child, a boy here, is very uncomfortable. And so this also needs to be managed medically. Usually when there is genital swelling, we will admit a child for that. Let's talk about another form of danger sign. This is a sign of serious infection. And I'm not talking here about coughs and colds, but of high-grade fever that's not going away. If there is a lot of fluid in the abdomen that could get infected, so the child could have stomach pain, loose motions, vomiting. This is what we call in medical terms bacterial peritonitis. There could also be lung infections like pneumonia leading to cough and breathing difficulty, and even skin infections could occur. And this you will see as a sort of, in this top picture here, persistent area of skin redness and pain. So all these are signs of serious infections that need to be shown to the doctor as soon as possible. What about vaccines? What vaccines does Sonia need? Well, first of all, it's important to remember that vaccines prevent life-threatening infections. However, always consult your physician before giving vaccines, because during steroid treatment, killed or inactivated vaccines can be given safely and are very important. However, during steroid therapy and with therapy with other stronger medicines, if they are going on, such as MMF, it's important not to give live virus vaccines. And here are two examples of live virus vaccines: oral polio, MMR, and of course, chickenpox. So while you don't need to remember which vaccine is killed and which vaccine is live, it's important to discuss with your doctor whether a particular vaccine is safe to give. Extra vaccines for nephrotic syndrome are important. These are pneumonia vaccines. You may have heard of one called Prevnar 13. And when it is safe, it's important to try and prevent chickenpox if the child has not already had it. Influenza vaccines given annually are also recommended. Vaccines are important, and they also don't cause nephrotic syndrome relapses really, so one shouldn't be afraid of them. So if you guys know this statue, this is a picture of the little boy in Brussels. This is a famous statue. And before I show you anything on the slide, this is the first thing that parents will notice when the response to steroid therapy starts. So what is remission or response? By definition, it is the urine albumin being negative, nil or trace for 3 consecutive days. In practice, we see that the urine albumin goes away, the swelling disappears because the child has passed plenty of urine, and the child also looks really well. Children who respond to steroids are called steroid responsive or steroid sensitive nephrotic syndrome, and they have achieved remission with steroids. Determining for the doctor to determine whether the nephrotic syndrome is steroid responsive or steroid sensitive is very important. And so the close follow-up on an outpatient basis with the doctor is essential. Now, Sonia was fine. She went into remission. She did well. She was taken off steroids and was fine for 2 months. But then her parents came back very upset, saying the swelling has come back. First thing to remember is not to panic and to seek medical care. Nephrotic syndrome is a relapsing disease. It can come and go, and that is the normal course of the disease. So by definition, a relapse is defined as the urine albumin being at least 3+ on 3 consecutive days. We don't always ask parents to do daily urine dipstick testing, and so in practice, a child who was in remission or a child who was fine without protein in the urine has a return of the protein in the urine along with swelling. And we often find that minor infections trigger these relapses, coughs and colds. And treatment of relapse involves, of course, steroids again, but a shorter course. So I'd like to begin to summarize the basics of nephrotic syndrome here by telling you that majority, 90% of children with nephrotic syndrome are steroid responsive. This means that the outcomes will be very good. About half of these children will only have relapses 1 or 2 times a year, and these are called children who have infrequent relapses. And we treat these children with steroids only because we are not worried about the long-term side effects of steroids appearing. The remaining children may have relapses a little too frequently for us to be comfortable giving them repeated doses of steroids. We are worried then about them developing the longer term side effects of steroids like growth suppression. And so these are the children that we decide to treat with stronger other immunosuppressants. You may have heard of some of these. They are mycophenolate, tacrolimus. Sometimes we use medicines like cyclophosphamide and levamisole. The names, if you don't know them, are not important, but they are the next line of medication, and there are plenty of other choices to choose from. A minority of children do not respond to steroids, and these are called children who have steroid-resistant nephrotic syndrome. Their course is a little bit more complicated, though we can certainly manage such children successfully. They need a detailed evaluation and management plan, which I won't discuss too much in detail here. So, nephrotic syndrome in a nutshell is a relapsing disease that can be successfully treated. Medication compliance and follow-up is very important, and most children have excellent outcomes. There are certain misconceptions that I just wanted to bring up and mention. The first is that the thought that nephrotic syndrome is due to some fault. Either the kidney has some infection in it, or the parents sometimes feel that I fed my child the wrong diet, or they ate too much salt, and that's why nephrotic syndrome appeared. That's not at all true. We are not sure why a child gets it, but it's of no fault either of the child or of the family or diet or environment. The second misconception is that steroids are dangerous and must be avoided. And as we've discussed that this is not true, because steroids actually are the most important treatment for childhood nephrotic syndrome. The third fear in many, many parents' minds is that nephrotic syndrome leads to kidney failure. And I'm here to tell you that childhood nephrotic syndrome is not at all like nephrotic syndrome in adults. And so therefore, as I've shown you in the previous slide, kidney failure is really not a concern at all. But if you do have such concerns and fears, you must discuss it with your doctor. But minimal change or childhood nephrotic syndrome does not lead to kidney failure. So that was my summary of the basics of nephrotic syndrome. And I'm now going to take you on a little bit of a deep dive into the two more complex aspects of nephrotic syndrome with Dr. Arpana, and I'm going to ask her a couple of questions here.
Thank you, Priya. Good evening, dear parents and children. I'm sure children also must be listening to us because now they've got used to being on an online mode. So Priya has given a very clear and comprehensive overview of this problem, and I'm sure parents they recall their experiences in their own journeys with their children, and have taken her points in good sense. And we would like to, of course, interact with each one of you. Because you, I'm sure, will have more questions to ask and more clarifications to sort out. So we will do that in a bit. But then Priya's put a question here. Do we need to perform a kidney biopsy for Sonia?
That's such a common question that, we get. So what do you have to say to that?
Yes. So many times when children are being treated by pediatricians, they are sent to a specialist like a nephrologist because they are being told that probably your kid needs a biopsy. So first of all, biopsy is not a treatment, it's a test. So this test is not indicated in every child with nephrotic syndrome. So parents get this feeling that probably if my child undergoes a biopsy, maybe this problem will be solved, isn't it? Most of them come with that kind of feeling to us.
Yeah.
And then we'll have to tell them, look, this is not treatment. This is a part of the investigation, and it's definitely not indicated in most of them. So like Priya was mentioning, 90 out of 100 kids respond to steroids. And if they respond to steroids well, and they don't have too many relapses, or they're not complicated, they respond well, and they have a few months wherein they don't need any treatment, they don't have any swelling, then such children definitely don't need a biopsy. Biopsy is required only in situations where children don't respond to steroids. And that is, like you just heard, 10 out of 100 children. Or if they need some special medications that need a biopsy before we start treating them with those medications. So clearly, kidney biopsy is not a first-line test that is required for all these kids.
Great. Yes, I agree that, that's a concern that many parents have, and they're worried about the biopsy procedure. And we can talk more about it if you have questions. But for now, I'm going to continue our deep dive into the ocean of nephrotic syndrome by moving on to what is new and exciting, I guess, genetic testing. So this parent said, what about genetic testing? My one child has it. What about my other child?
This is a very interesting question, Pia, and we do discuss this quite often, that the term nephrotic syndrome itself is a misnomer, because there's this word syndrome, and ideally when you talk about syndrome, you know that it's connected to something to do with development, and probably there could be a genetic etiology, and we face this problem very often with the insurance people and insurance companies who look at the term nephrotic syndrome and immediately consider it to be a genetic disease. So that's why it probably is a misnomer in that sense. So genetic testing is not really required for every child with nephrotic syndrome. Genetic testing would be required only in two key situations. One is when a child doesn't respond to steroids. Again, we're coming back to the minority of 10 out of 100 kids. And if a kid has got this nephrotic syndrome for the first time in the first year of life, because that again is related to some underlying genetic defect. So I think these two would be the most important indications to think of genetic testing. Otherwise, we don't need genetic testing in all kids.
I agree. I think certainly in this arena, we don't use genetic testing at all in clinical practice, unless really these two conditions of steroid resistance or very, very young age onset of nephrotic syndrome. So I think I will stop sharing my slides here and now wait to hear from everyone. We are here to answer all your questions. So back to you, Marianne.
Hi, Doc. First and foremost, very, very well presented. I mean, nephrotic syndrome is a very, very new subject. And I was actually able to understand this broad, wide, deep subject, at least in a nutshell, of what is exactly happening and the misconceptions that go with the same. So my question to you would be, what do you think are the most common mistakes that families make when their kids are diagnosed with nephrotic syndrome?
I think you already mentioned some of these points in your talk. So Priya, you can go ahead.
I think the first thing that I would tell a child, a parent of a child with nephrotic syndrome is don't be afraid. That is the first thing that I would say. We are putting the treatment in your hands, as in you will treat the child at home, but it is not difficult to do. And if you understand how to give the medication, don't be so afraid of harming your child or making mistakes. Sometimes we do see a couple things that could be, not done or could be done better. So one of those I would say is not coming regularly for checkups, because we do want to see your child improve as much as you do, and documenting this response to steroid is critical or key. The second is we always tell parents that even though your child has gone into remission, that means the urine protein has become nil, it's very important not to stop the treatment. It seems like we are giving treatment for a long time, 3 months, but that is very important to prevent the relapses from coming back again and again. So to just follow the course of treatment, even though your child looks fine, I would say is the very important point to keep in mind.
If I may add, Priya,
Yes.
some of our parents would like to Google before even coming to us.
Yeah.
So I would like to tell them that please don't Google, because once you put in those keywords from a very simple nephrotic syndrome, yes, it is simple because we doctors see many more complex kidney disease. So it's simple. From that simple entity, you will be led to a page of transplantation, which is totally irrelevant. So we have had parents coming and say that we have gone through dialysis and transplantation for simple nephrotic syndrome. So let's not Google. You come to your doctor and ask doctor the questions, and you'll get the right answers.
In fact, I think giving parents reading material is really useful. And so at the end of the session, if you'll remind us, Marianne, we'll actually share a resource that we use in our center, and we are very happy to share with you as well as a reliable reading resource.
Sure, Doc. Doc, this question is coming from another family who does not have much knowledge on the disease. And the question is, nephrotic syndrome does not have to end with a complete kidney failure. Is that right? They ask us. And they say, in what cases does it end with a complete kidney failure?
Okay. So this question is important because we have already heard from Priya that it is a misconception that nephrotic syndrome is something like kidney failure. So let's all remember this, that nephrotic syndrome in the majority does not have any problem with the creatinine or kidney function. It's just the leak of proteins in urine. However, to answer the second part of the concern of this particular family, there can be a very small proportion of children, say about 5 to 10, who don't, out of 100, who don't respond to steroids. And in those also, if they respond to other medications besides steroids, then their renal functions are well preserved. But if they do not respond to other medications, and other medications, we do have a big list of them. It's not just 1 or 2. And then we try one after the other. And these treatments go on for years. And if they don't respond to any of these, then the urine leak is going on for years, they're not responding, then there is definitely a risk for kidney damage. But otherwise, in the majority, there is no risk for kidney damage, despite having repeated episodes of swelling, repeated episodes of protein leak, repeated episodes of getting different kinds of treatment regimes.
I have a question here from Nitesh. Nitesh, can you open up your camera if you don't mind, and can you post your question, please? Okay, I'll post it on behalf of the family. Steroid-dependent nephrotic syndrome. What is the major side effect of taking such steroids for a long period of time?
Go ahead, Priya.
Okay, so you've used a very specific term that I didn't actually discuss too much in my basics talk. You said steroid-dependent nephrotic syndrome. So what is that for everyone here? Some children seemed to do very well and respond to steroids. However, when we try and stop the steroids, their protein in the urine comes back very quickly. So as soon as we stop the steroids, they become swollen again. So these children seem to depend on steroids, as it was, so they're called steroid dependent. As long as they respond to steroids, again, we are not worried about kidney damage, but what we do get worried about is the long-term side effects of steroids. So these are in children. This does not apply to adults, but in children, affecting growth. So the rate of growth seems to slow down. The second is high blood pressure, and there are other, a little bit of weakness of the bones. Perhaps the calcium is not well utilized in the body. There could be some higher blood sugars, etc. So in children who've been taking steroids every day for many months at a time because they keep relapsing, these are the steroid side effects that we then get concerned about. And then we introduce other stronger medications, and these are called steroid sparing immunosuppression. But it's important to remember that even though we use these higher order medications, we may still have to use steroids from time to time to bring about that urine from 3+ to go to nil. But we hope to minimize how often that happens by using these stronger medications.
Thank you, Doc, for that answer. My next question would be, since I understand that nephrotic syndrome is a long-term syndrome that parents deal with, what happens according to both your experiences in terms of the mental and the emotional fatigue of the family? Because I think they live in constant anxiety of where they're going forward to. Thinking that we might lead to kidney failure would obviously be the first fear that families live with. Can you tell us how would you help these families cope with a positive mindset to help the child?
I'll just begin, and then I think Priya will add on to the specific issues of emotional concerns, caregiver burden, and so on in these children. So we all understand now that it's a chronic disease. And I always give an example of asthma. In asthma, you keep having repeated wheezing attacks. So it's something like that you will expect your child to have episodes over time. And I think as parents, it's very natural to ask your doctor, when will this stop? I heard someone say that, when my child attains puberty, then this problem is going to subside on its own. And somebody else would say 10 years, 12 years. So these are all speculations. There's no evidence to suggest that nephrotic syndrome will disappear at 10 years or 12 years. So it's always better to get your parents mentally prepared for this disease to stay during childhood. Because many times I have said to parents who came to me with a 2-year-old kid that, as a child grows and by 12 to 15 years should be off the problem. And today that kid is 18 years and I had to transfer the child to an adult nephrologist. And the parent asked me, I thought that we would end this problem with you and now we're going to begin with a new doctor. So this happens. So it's really not predictable anywhere in the world. And it's difficult to say when the child would get off the problem. So it's definitely a chronic course. And parents always feel guilty. Maybe we've done something wrong somewhere, and they go back to their pregnancy time, especially the mothers, and say, oh, in pregnancy, I ate this. Is this why my child has got nephrotic syndrome? So it's so natural for them to look at, why my child? Why did my child get this? And why did one of my child get it? The other child is all right. So we need to spend time and, handle all these concerns, reassure them. And it's very easy for us to do this in about 10-15 minutes. But let's not forget that it's parents who are going through this journey with their child every minute, every day. And Priya will add to all the psychological, behavioral, emotional caregiver concerns that goes on which is not evident unless you actually spend time and dig out these aspects in these families.
Dr. Arpana, just before I go on to Dr. Priya, one thing that I'm getting to understand and sense over here, and based on what Dr. Priya also presented, there is no particular reason why nephrotic syndrome happens. And if it happens to one child, it doesn't happen to the other. So can we assume or put it down to acceptance is a very, very key factor for families when it comes to nephrotic syndrome?
Yes. That's what we do. We tell them that there's no particular reason that you can avoid or you can prevent now, because that's what they want to know. Can we do something so that my child will never get a relapse, right? So we say that there's nothing, that's not an option. You don't have an option to prevent another relapse from occurring. If we have medications that will prevent many relapses from occurring, but you can't just guarantee to parents saying that, okay, I'll give you this treatment with steroids and your child will not have a relapse anymore. So I think it's important to tell them, see, mentally, you have to accept that you have to deal with this chronic problem. But it's also important to, in the same breath, highlight the positive nature of the problem. You say that, your child is not as bad as a child who has diabetes, who has to take insulin injections every day. Your child has not got kidney failure. Your child has just got protein leak in urine and needs to take some medications and will outgrow this in the majority over time.
Yeah, Dr. Priya, you can continue on the previous question.
Sure. So when we discuss nephrotic syndrome, remember when we discuss as doctors and we use words as simple and easy to treat, we are talking very medically in terms of making that urine protein nil. It does not mean that we believe that you parents should think it's a simple problem, and nor are we sort of pretending that it's not an issue. It is an issue. And in what ways is it an issue? Well, first of all, I think many of you will find distressing the fact that you see swelling, right? It's very scary to see and frightening. So one thing to remember is that swelling for the most part is not at all dangerous to the child. It's just a signal that we need to treat them. The second is the steroid side effects, even though they're temporary, even though I call them minor, they induce quite a marked change in the appearance of the child. They have what's known as that steroid phase. And so that leads to a lot of questions from other people, neighbors, well-meaning neighbors who are very nosy, or your family members. What's wrong? Why are you giving steroids to the child? And this leads to a lot of distress in parents, because oftentimes we as parents don't want to disclose everything that's going on in our family. So dealing with that emotional stress of having to explain again and again what is happening with your child is definitely a source of burden per se. Small children with nephrotic syndrome are usually very young, so they themselves don't often feel bad about their change in appearance, but we do have children as they get older who continue to relapse. And they do get upset by the change in appearance. They oftentimes don't want to go to school because they look so different from their peers at a very age when, adolescents, they want to look just like their friends, and here they're looking very different. So these are issues that you should bring up with your doctor. It may help to share with the school that my child just has a problem that needs treatment and this is temporary. And sometimes just having friends support the child instead of, wonder what's wrong will actually help your child. And similarly, as parents, if you really feel that your tension, your mental tension or your mental feeling of feeling upset is really very bad, bring it up with your doctor so that we can help you cope with it along with your family members as well. It's an area of research as well, I think, that is ongoing. So as doctors, we are not only interested in the medical treatment of the child, but also in the well-being of the family and the child as well. And so this is an area of research that is ongoing to identify how best to help families cope and especially, in different situations and different types of diseases as well.
Another important approach would be to have support groups, Priya, like we do for many chronic diseases, so that parents will meet the families that are going through a similar journey, and that would also help them cope with the chronic illness.
Yeah, I think a forum like this is actually perfect. It's a safe place to discuss a lot of issues. And so I definitely agree that, parent support groups dealing with the same thing are great.
Thank you, doctors. Here we have a parent asking us, my son is now negative for the last 4 months, but still has crystal and pus cells coming in his urine.
So being in remission means that there is no protein leak, which is good. So I'm assuming that the child is not on any treatment or not on steroids, and that's why the urine is negative and the child is in remission. The finding of crystals and Wbcs is non-specific. These two features in urine is not really directly connected to the protein leak or nephrotic syndrome. So sometimes if you're not taken enough of fluids, then you can have very concentrated urine and some crystals may be seen. White blood cells or pus cells doesn't really mean anything unless you also have the child manifesting with some fever, some burning urine. Otherwise, it doesn't just tell you that there is infection. So just by looking at pus cells in urine doesn't mean that there's any urinary infection. It's better for the doctor to interpret this report and look at clinical signs along with clinical signs to give a proper advice. But both these features are not in particular related to nephrotic syndrome.
Thank you, Doc. We have one nutrition-related question, and somebody is asking us, can we give protein drinks for a nephrotic syndrome child, or would you suggest giving protein only in form of food?
I think you saw a lot of nice pictures in Priya's presentation. So reinforce these parents.
I don't think there's, so with protein leak, it's a natural probably idea that if the protein is being wasted, let's give more protein to the child to eat. And that doesn't help the child actually in any way. So one should neither give extra protein nor less than the recommended amount of protein. The best way to have protein is to eat it in the form of food. And so protein shakes and protein, other forms in liquid form, when you're just adding protein powder, are really not required at all. It is almost better for the child to just take it in the form of healthy food, which is easily digestible. And I would avoid any protein shakes.
Just to add to it, sometimes parents are given the impression that some kinds of food stuff cause allergy and that triggers a relapse. Like I had families coming in saying, my child took paneer today and that's why the urine has become 2+ the next day, or has taken egg white, and then so they do find some kind of connection between some foods and relapses, but really there's no evidence to suggest that this is a universal phenomenon. So just to reassure that one doesn't need to avoid any kind of food in particular.
Right.
So we have a little kid in our community who's quite known. Aryan, can you open up your camera, please? Aryan, can you open up your camera?
आर्यन मम्मी मैम आर्यन क्लास में गए तो थोड़ा सा प्रॉब्लम है इसलिए
ठीक है
आप पूछ लीजिए।
आर्यन को ना हाँ आर्यन को थोड़ा प्रॉब्लम हो रहा है इसलिए क्वेश्चन पूछने का था मुझे। आर्यन का क्रिएटिन ना 1 महीने पहले 3.22 था, अभी 2.85 है, तो उसमें उसको बहुत प्रॉब्लम होता है, स्टमक पेन होता है, उसका लेग पेन होता है, उसको बार बार वोमिट होता है, ऐसे चक्कर आता है बार बार। उसका एक किडनी फेल है और दूसरा भी अभी थोड़ा सा रिपेयरिंग चालू है, डॉक्टर के में चालू है ट्रीटमेंट, डॉक्टर दिव्या वाजपेयी ट्रीटमेंट कर रहे हैं।
ठीक है। जो आपने बताया क्रिएटिन के बारे में, वो क्रिएटिन नॉर्मल नहीं है, उससे पता चल जाता है कि शायद ये नेफ्रोटिक सिंड्रोम नहीं है जो बीमारी हम आज बात कर रहे हैं। हाँ, तो किडनी का जो डैमेज थोड़ा हो गया है वो नेफ्रोटिक सिंड्रोम के वजह नहीं हो सकता है शायद। वो आपने बताया कि एक किडनी ठीक नहीं है, तो दूसरी बीमारी की वजह से ऐसा हो गया है। तो आज हम नेफ्रोटिक सिंड्रोम करके एक बीमारी के बारे में बात कर रहे हैं। तो
आर्यन को भी था ना, आर्यन को था नेफ्रोटिक सिंड्रोम, फिर बाद में सीक्रेट स्टेज पे आया वो। पहले नेफ्रोटिक सिंड्रोम से स्टार्ट हो गया। सीनियर केजी में था, 12-13 साल हो गया वो बीमारी से, फिर अभी तक ये स्टेज पे आया।
क्या क्या दवाई लिया पहले?
अभी उसका ना फाइल ना केम में लिया है, नहीं तो सब दवाई बता देते हैं। उसका फाइल ना परफॉर्मा के लिए दिया है, डॉक्टर दिव्या ने लिया है, तो दिव्या मैडम ने लिया है। तो फाइल अभी लेटेस्ट का 2-3 है, सब 2-3 फाइल ले लिया है परफॉर्मा के लिए।
ठीक है। तो कभी कभी हमने पहले ही बताया कि कभी कभी हो सकता है कि नेफ्रोटिक सिंड्रोम जब होता है और ट्रीटमेंट देने के बाद भी वो कम नहीं होता है, प्रोटीन लीक यूरिन में कंटिन्यूसली प्रोटीन लीक होता रहेगा, दवाई लेने के बाद भी होता रहेगा, तब किडनी डैमेज का रिस्क होता है। ठीक है,
एक इंजेक्शन दिया था रितुमैप से करके।
हाँ, रितुमैप भी यूज करते हैं हम लोग, और उससे कम नहीं होता है और क्रिएटिनिन ज्यादा होता है, तो रितुमैप का असर भी उतना नहीं होता है।
नहीं, 1 ही साल हुआ, तो फिर बाद में 4 इंजेक्शन दिया था उसको। तो 1 साल में फिर से बढ़ गया, तो अपना फिर केम में स्टार्ट किया फिर ट्रीटमेंट, तो उधर बोले सीकेडी स्टेज पे गया है।
हाँ, तो कभी कभी होता है ऐसा कि नेफ्रोटिक सिंड्रोम जो भी ट्रीटमेंट देते हैं हम लोग, उससे कम नहीं होता है और किडनी का डैमेज बढ़ता रहता है, इसलिए वो
प्रॉब्लम
सीकेडी नाम। हाँ,
एक किडनी छोटा था जन्म से उसका।
अच्छा।
और उसको दो बार निमोनिया, डायरिया, 2 बार बहुत टाइम उसको बहुत बीमारी होता, 8-8 दिन में एडमिट होता था वो। तो उसको बहुत दवाई दिया, इसलिए सब बढ़ गया उसका।
ठीक है, अपना डॉक्टर के पास आप ठीक से रेगुलरली चेकअप के लिए लेके जाओ, जो डॉक्टर कहेंगे ऐसे ही करो। ठीक है,
हाँ, ओके, थैंक यू सो मच।
आपको बताना था कि जो हम लोगों ने बोला है कि नेफ्रोटिक सिंड्रोम जो बच्चे में होता है यूजुअली रिस्पॉन्ड करता है ट्रीटमेंट को, लेकिन आपके बच्चे ने एक्चुअली रिस्पॉन्ड नहीं किया है और सीकेडी में है, यानी कि किडनी डैमेज हो चुका है। लेकिन आपको समझना और एक्सेप्ट करना और बहुत इम्पोर्टेंट है कि उसका मतलब ये नहीं है कि नेक्स्ट कुछ नहीं कर सकते हैं, काफी कुछ कर सकते हैं बच्चे के लिए। सो जैसे डॉक्टर अर्पणा ने बताया ना, जो
बच्चे बहुत स्ट्रांग है, बच्चा स्ट्रांग है, मैं स्ट्रांग नहीं है मैम।
आप लोग भी स्ट्रांग दिखते हो।
नहीं, मैं इतना स्ट्रांग नहीं, मैं बहुत डिप्रेशन में गई थी अभी लेटेस्ट में, तो मेरा ट्रीटमेंट चालू, काउंसलिंग चालू है मेरा।
ठीक है,
मेरे को तो बच्चे को इतना नहीं है, पर मेरे को ज्यादा काउंसलिंग पे देखा है।
हाँ, मालूम है कि बहुत डिफिकल्ट है एक्सेप्ट करना और ट्रीटमेंट देना और फैमिली को लुक आफ्टर करना, तो बट प्लीज हार मत मानिए।
हाँ, नहीं हार नहीं मारे, तो डॉक्टर ने मेरे को भेजा केम के हॉस्पिटल में ही चालू है मेरा ट्रीटमेंट काउंसलिंग का। तो एक टैबलेट दिया वो, हाँ अभी चालू, थोड़ा सा कम हो गया, नहीं तो बहुत डिप्रेशन, पूरा माइंड मेरा 0 हो गया था। तो थोड़ा सा ठीक है, अभी थोड़ा ठीक है, एक्सेप्ट किया है। थैंक यू। बच्चे बहुत होशियार है, कैसा बहुत स्ट्रांग है, मतलब मास्टर माइंड है, वो सब एक्सेप्ट करता है। थोड़ा साथ नहीं दे रहा उसका थोड़ा शरीर, पर वो स्टडी अच्छी तरह करते हैं वो, पर
अच्छा है हमारे बच्चे ना, वो हमको हिम्मत देते हैं, बच्चे लोग बहुत स्ट्रांग होते हैं। ठीक है,
ओके, थैंक यू मैम।
थैंक यू।
Doc, one more question. Can you touch upon once a nephrotic syndrome patient undergoes a transplant, chances of reoccurrence, does it happen?
Well, so this again is a very rare possibility that a child with nephrotic syndrome is not responding to steroids and then is not responding to other medications too. And then slowly the creatinine rises, they get into the Ckd phase, which is chronic kidney disease from stage 2, 3, 4, and 5. And when you land in stage 5, that's when a dialysis or transplantation is required. So once a child really reaches that stage, and if they have a nephrotic syndrome with something called focal segmental glomerulosclerosis, which is a pathological term which causes the resistance to steroid therapy, then there is a good chance that the protein leak can reoccur after transplant. Now, we spoke about genetic testing and we said that these children need genetic testing. And one of the important utilities of genetic testing is that if you have a gene defect detected and they go on to having steroid-resistant nephrotic syndrome, if they have a gene defect, then they are less likely to respond to any other medication too. So probably with the genetic test being positive, doctors have the opportunity to tell parents that let's not waste time or money on various kinds of immunosuppressive therapy, which are all expensive, and because your child is not going to respond to them. And we also don't want the unnecessary side effects of these immunosuppressive drugs. So if you have a genetic positive report and you land up needing a transplantation, the brighter side of it is those who are positive will not have a recurrence post-transplant. So if you're genetic negative, then you have a 40 to 50% chance of recurrence after transplantation. And this information is told to every parent and family whose child has reached that stage, and they understand. But when we counsel, and for those parents who have taken that step of going ahead with transplant, despite understanding the fact that 40 to 50% recur, they always look at it from the other way and said, there's 50% chance of not recurring. So why not give the child that chance? And therefore, we have many of these kids doing well post-transplant, some of them needing some supportive therapies even after transplant if they have recurred. So there is a solution to both. Pardon?
I said the recurrence is also quite responsive to therapy.
Yes,
this
therapy.
is sort of straying away from our general childhood nephrotic syndrome as well. But certainly we have successfully treated children who had a recurrence of nephrotic syndrome after transplant as well. But these are very, very rare scenarios for the average family with a child with nephrotic syndrome.
In a country like India, based on your experience, at what age do you think an average aware parent is able to figure out that the child has nephrotic syndrome? Now that these topics are more well spoken about in our community and there's more awareness, at what age does this happen, Doc?
So nephrotic syndrome, the typical age of the childhood, what we call simple childhood variety nephrotic syndrome, is between the age of around 1 year till around maybe 8-9 years. And it's not a mystery when it occurs. The swelling is really evident to see. So it's not going to usually start silently and go on without anybody knowing anything about it. The swelling is obvious. There are other forms of nephrotic syndrome that occur outside this age range, that is adolescent children, where the nephrotic syndrome starts for the first time, in 13, 14, 15 years of age, or very young infants, children around, less than 6 months or so. So those children are not the focus of our talk today. Those children do need a little bit more extensive evaluation, and we do much more testing, a little more complex treatment. But for the average childhood nephrotic syndrome, the onset is between 1 year to on average around 7-8 years.
Thank you, Doc. I think I'll end this session with one message with a lot of love and a positive information, reaffirmation to the community. So, Dr. Priya, since you're unmuted, I can start with you. To our families watching, just one message that will send some love and some positivity to the families out there.
Sure. So my message to you all would be that the childhood form of nephrotic syndrome is really very treatable. You should be able to manage it at home and form a strong partnership with your doctor who's treating you, either the pediatrician or if you happen to have a pediatric nephrologist close by. And together, the physicians and you work together. You're almost like a team. And together we will help you take care of your child in the best possible way. So.
And my message, in addition to what has been said, is that parents, please be aware that these features of nephrotic syndrome and the concerns surrounding nephrotic syndrome change with the child's growth. When the child is younger, then you have a different kind of swelling appearance. The child is a little older, the swelling is not so obvious, but the urine is spilling proteins 3+, 4+. The child is not so swollen up like how the child would have been when the child was younger. And concerns about looking chubby is nice when they're young, because everybody would touch and pinch their cheeks and say you're looking cute. But the same thing in a 14-year-old, he doesn't like it or she doesn't like it, and she feels that her face has got distorted. There is slightly hair growing in odd places, and there are some kind of behavioral problems. They are more moody and or very lethargic. So these change with time. So parents need to understand that the symptoms or problems of the same disease can manifest in different ways throughout childhood, in different phases of child's growth.
Thank you, Dr. Arpana. I think that was very important for us to know as well. And well, that brings us to end. I'm sure we have a lot more questions, but then time is time. We have come at 6:30. But those of you who have questions, I'm going to request you to please put it across to us. And I think we have the PDF also sent out. For those of you who need more information, we'll send the PDF out, which is very informative. Most of your questions will be answered in the PDF. But if you still have further questions, as always, we're happy to take your questions and run it through by Dr. Arpana and Dr. Priya. But until for now, this is me, Marianne, from the Ckd Warrior Foundation, thanking both our doctors for joining us this evening. Your time is indeed greatly appreciated. Thank you very much, doctors, for joining us. And I'm hoping that our community did find this session really beneficial. Thank you.
Thank you so much.
Thank you so much for having us.
Doctors, can I request you to stay back, and can we stop the live?